Welcome to the Drivable Podcast. I'm Ali Akbarian and over there is Brad Williams. Today we're talking about complex seating with Tracee Lee Maginnity, who is the clinical educator and seating specialist at Permobil. Permobil is one of the largest manufacturers and most reputable manufacturers of wheelchairs in the world. And this will be a great episode. I'm really excited. And Brad, you excited? You ready?
I am. This is going to be excellent. So let's get into it.
Welcome to the Drive Able podcast, where each episode you get to listen to two of Australia's leading professionals in the area of driving and community mobility for people with disabilities. In each episode, they interview drivers, carers, and industry experts and share the insider's guide to driving with a disability. Here are your hosts, Brad and Ollie.
Hi everyone, I'm really excited to get into today's interview, but before we get started, we just want a quick shout out to our sponsors who make this show possible, Mobility Engineering and Williams OT. This show takes time and money to put together, and we are forever grateful to their passion for our industry. Okay, enough of the business, let's get into the interview. Today we have Tracee Lee, who is the clinical educator at Permobil, joining us today. So Tracee Lee, thanks for joining us. Can we first start by asking you to introduce yourself and tell us a little bit about your position and how you got there? But before you do that, I was going to say your last name, but maybe, is it Maginnity?
Very close, Ali. Maginnity.
Maginnity. Okay. So that's why I didn't say that, but that was the first question. How do you say your last name? Maginnity. Okay.
It kind of rhymes. Tracee Lee Maginnity.
Tracee Lee Maginnity. All right. So tell us about a bit about your position and how you got there.
Okay, thanks for having me today, Ali. As you introduced, my name's Tracee Lee. I'm a registered occupational therapist, and I've been doing seating and mobility for many years now. Moved to Australia about 10 years ago and worked in a variety of different areas, from prescribing, assessing, and ended up here as an educator at Permobil. So that was kind of like a bit of a goal job, career choice. I wanted to work for one of the manufacturers. I wanted to work for one that I believed in the products, and I wanted to be a clinical educator. So that's kind of where that journey led me to this point now.
Well, congratulations on getting your dream job. That's excellent. Not everybody can say that. So a big congratulations to you. Tell us a little bit about Permobil.
So Permobil is a wheelchair manufacturer. So it started off manufacturing powered mobility bases. Our founder, Per Uden, is Swedish, so it's a Swedish company. And it was built on this philosophy that Per often quotes, that every person has the right to have his or her disability compensated for as far as possible, but aids with the same technical standard as those that we all use in our everyday lives, which I think is something that probably resonates with the both of you as well. Like finding some of these amazing solutions in mainstream, but, like having that ability to access some of those things, or accessing technology that makes it more of a level playing field for everybody to gain independence.
Yeah, that's pretty cool. I wonder if that's a general Swedish philosophy, because we deal with Brawnability a bit, and they're the Swedish arm, and the Swedish seem to be very much into that philosophy of kind of like equalization, and it's also, like, when I say equalization, on all levels. So a lot of the technology, it's all about, well, if an able-bodied person can have it, why can't I, type thing, and we've actually heard on this podcast so many stories of people that have had to create their own things because, there's nothing available in this industry, and they've just had to innovate themselves. You hear it time and time again.
Absolutely. I love that number 8 wire kind of philosophy that, we'll make something work, especially when we are talking about very individual solutions for very individual needs out there, Ali.
Yeah. No, that's pretty cool. And how long has Permobil been around?
So look, Permobil did one of the first standing powered wheelchairs, like about over 50 years ago, I think it was now. So, they really have evolved in that area of powered mobility. And there's also been some acquisitions or some mergers along the times as well, where we've invited other really great manufacturers into our family. So the Roho seating, for example, Tri-Light manual wheelchairs. So we're manufacturing those alongside our Permobil products. So some seating and some mobility needs being met.
Yeah.
Well, I guess
fantastic.
now that you've mentioned that stuff about the seating, I know that you are a bit of a specialist in the seating area, and I guess we are happy to talk about everything in seating, and wherever we can try to skew it towards setting up stuff in vehicles if possible as well. So, and on that note, I guess what kind of things or do people look at when they're looking at, let's say, getting a wheelchair? And then how much of that do you think can be transferable or to a vehicle? Like you're sitting in your wheelchair. Let's say you're not able to sit in the wheelchair in the vehicle. How easy is it to replicate some of that seating systems within the vehicle?
Look, Ali, we've got that general seat and we've got that general position, that seat to back angle of the vehicle seat, which doesn't often have as much adjustability as we would have in the actual wheelchair. So for some users that are able to be transferred, and obviously we support that as well, if somebody can be transferred into a vehicle tested seat, then they should do so, opposed to being in the wheelchair. So if we can get them transferred, then that's good. It's going to come down to that impairment. Somebody with a spinal cord injury, for example, may have less trunk control, trunk innervation. So they might need, just a little bit of extra support in some of the strapping, for example. I've also talked to people before about using little towels just to sort of lift up the knees a little bit or lift up the feet a little bit, just to get them seated in a very similar position. Because sometimes that postural position, it's not just about getting from A to B, it's around being as stable as possible. And obviously when we've got the inertia and we've got a vehicle that's moving, we want someone to be really nice and stable within that seat that's pretty much designed for you and I that have full muscle control and innovation.
With that, actually, one thing I was just thinking of, which is something that Brad and I have actually discussed a fair bit on the field, and I wonder if there is an easy answer to this. So looking at this this picture here, or wherever I say in the background here, that you can see in my picture, that swivel seat. Now, that's a way of getting in and out of the vehicle. And as you know, with NDIS and the massive increase in competition, there is a bit of a, there is pushes. Certain companies push their products over others, right? And in the area of seating in the vehicle, sometimes I find clients and OTs can get a bit confused as to when do I make the call of, is this person transferring or are they sitting in the wheelchair? What are some big markers or indicators that, hey, this person just can't transfer, or we're not, like, we shouldn't be entertaining this idea, we're just wasting our time, or vice versa, or like, hey, this person can get into a seat, we shouldn't be entertaining a lowered floor vehicle, we should be entertaining something like this in the background, or vice versa. Is there any markers there?
Yeah, look, so many different things entwined into there, isn't there, Brad? I think, having a very clear idea of the goals and what's really important to the person that's going to be using the equipment and transporting is obviously going to be that foundation and very important. And that image that I see behind you, Ali, it does bring to mind a client that I had many years ago in New Zealand who had motor neuron disease. And this client really wanted that chair. Meanwhile, I was really concerned that the money that was getting put into that vehicle modification meant that they weren't necessarily going to be able to have the money within that system to be able to transport the powered chair, and so this client in the chair. And so to me, it was a real ethical conundrum, but it wasn't my conundrum to have. That was my values. When I sat down and talked to them, the most important thing to this family was that they could drive to the river, drive up onto the riverbank and spend some quality time together as husband and wife, watching the river and talking to the river. They weren't as interested in being able to get out into other parts of their community. So really listening to people, I think, is really important. Brad, you looks like you had something there on that.
I'm thinking back to an interview that we did with John, and his favorite thing is actually going through the McDonald's drive-through. And he really struggles to do his transfers and take his wheelchair with him, but just that ability to get out of his house and just go for a drive without thinking about transferring at the other end of it all at a different destination, that wasn't important to him. It was all about going from his house back to his house again, and that was what he needed. So I'm glad that you're saying that as well.
I absolutely agree 100%. I mean, it can get really frustrating when somebody has this great piece of technology and they have a vehicle and we know they can strap it down and they can get out and about. But sometimes it is around balancing out, what is most important for that person. We can't sort of, measure it on what would be important for us, which is so easy to get caught up in, isn't it?
You can tell that you're an OT, Tracee. You can tell that you're an OT. No, it's fantastic what you're saying there. Absolutely. Goal-centered is what we need to be. And we do this podcast for everybody to listen to, whether it's the client themselves who wants to be able to get here or there, but also for OTs, but also for the NDIS, LACs and support coordinators as well, to actually understand that sometimes it's a stepping stone, that the first getting out and about is about just leaving the house. And then sometimes down the track, we can look at, well, now that we're being able to leave the house, maybe we can start looking at other alternatives about where we're actually going.
Absolutely. And like I look at my own child as he went through his teenage years as well. We didn't rush out and get a car. He had little steps that transitioned him along the way into life and getting out and about, just like anybody with an impairment needs to do as well. Going back to Ali's question around the seating, there are I have had a few users that have used the big universal strap, so a big thick neoprene strap that just to give a little bit more stability. But what that seems to generally with the clients I've used, what that's been around is a little bit of one-sided weakness, to the point where when they turned in the inertia of the car, they just had difficulty bringing themselves back into that center of gravity position. So just a bit of a cue. But I know that I've had many talks with Armin and Ali around pelvic positioning, and some of the positioning pieces on the seating are around the posture and are around the person. And sometimes that's going to be really important, because if you've got your end user in the back of the van, we need to know that they're going to be breathing, that they're seated upright, that they're safe. But we still need to be looking at that big picture as well, don't we? Like, how can we support them and keep them safe, and balancing that out? And I know that's something I get asked all the time from a lot of the OTs, is around, or they will justify putting on those pelvic belts as seat belts, whereas they're positioning devices. So, I know that we're all on the same page with that one as well, aren't we?
Yeah, they do not replace your seatbelt, everybody. The neoprene or other products that go around the chest or around the torso a little bit lower down, they are about positioning and keeping somebody stable in the car seat or in their wheelchair. They do not replace the seatbelt. The seatbelt needs to be, and Ali, you'll be able to explain this better, but actually attached to the car for that stability and safety. Is that right?
Yeah, that's true. But in saying that, the innovative guys at places like Permobil and Sunrise are sneakily coming up with new wheelchairs that are going to be coming out that have everything built in, seat belts and everything. I've seen a few little, they're coming anyway. I don't know if they're out yet, but I've definitely seen a few little bits and pieces with actual automotive seats that are coming on from Permobil or from Sunrise. So they're teaming up. They're going pretty like for example, I know Permobil, they are owned by the same company as Brawnability. And what we found that they teamed up, like Tracy said, there was a merger or something like that. They do a lot of these mergers and acquisitions on a higher level about 4 or 5 years ago. And then what we started seeing in, like, for example, that seat that you can see in the background is a Brawnability product, but then a lot of the Permobil stuff can now fit straight onto it because they're teaming up and they're and I guess to build a little bit on that, what I'm hearing also is that's what's important from the vehicle point of view is those little positioning stuff, the little postural stuff. It's these tiny little tweaks that can make, from a seating point of view, that seem to be able to make such a massive difference. And which is going to lead me on to another question is, does that make a big difference then when you're looking at short versus long trips as well? Like, and how much more sensitive does it get if you're going on a long trip, or do you just have to limit trips sometimes?
Absolutely, Ali, good question. And it is going to come down to the end user, to the impairment and to the sensations, etc. they're feeling. I mean, one thing that we talk about a lot without talking about is pain. And the reason I say that we talk about it a lot without talking about it is that pain is a very subjective thing. So very hard to measure. And historically, funding organisations haven't really taken on pain per se, but they will take into considerations things like sitting tolerance. So somebody needs to be able to sit, obviously, for the duration of that trip. And some of our rural remote users is going to be, even longer terms, or longer time periods that they are having to sit, and sometimes seating that may not support them. So having that support may increase that amount of time that they can sit. It may increase the comfort, and by increasing the comfort, increase that seating tolerance. We need to make sure that somebody's going to be safe for the duration of that trip. So, we know if we don't get the angles right and posture, if we try and sit somebody in a position that their body does not have the capacity to reach in terms of their range, then their body is intrinsically going to try and get out, is going to try and slip forward. And so I'm sort of doing funny things with my hands, because what I'm thinking about in particular is, if a seat is sort of at 90 with a seat in the back, but if somebody's legs only bend not quite to 90, they only bend sort of to that 80, that body's not going to fit in that seat. So that body's going to have to move to try and conform to that seat. So making sure that those angles are right for the person might come down to whether they can sit in a standard seat versus sitting in a seat with more postural supports. And Ali, yes, I have seen some of this interchangeability of componentries between organisations and vehicles, definitely. And I just think that people are looking more for a holistic solution in general. They want to be able to get everything from, sort of the same therapist, or there's this one-stop shop, which for us all can be a little bit daunting, because they are such very specialized areas of practice as well. The vehicle mods, the seating, the wheelchair, and they all need to work together and work beautifully. I think the worst mistake I ever made was back when I was working in the seating clinics, molded seating clinics. One of the first clients I had, of course, it's late Friday afternoon, and we've just managed to put all the seating over to the power chair. He's about to go home to the group home. The van pulls up. The tech's already done an hour's overtime. I'm like, yeah, it's Friday. I'm going home. We drive out. He goes onto the hoist. It starts to rise, and I wanted to just cry. I could see that he wasn't going to clear. So as he was going up, I just went, no, stop. we had to take it back, pull it off, and scrape it off underneath that cushion. So, lots of things to think about, and best to work together with some of the experts. So going to a good vehicle modification supplier, working with the therapists or the services that do have that specialty within their scope.
That sounds really good.
100%. You do need a team around you. I don't know about seating the side of things in regards to wheelchairs. I do know about car modifications, and I do know about access into motor vehicles. And I think forming a team, which is why we've invited you on, Tracee, is really, really important. And yes, having one OT to make life easier for you can be a good idea, but sometimes you've got to realize that we can't know everything. And the more technical your problem is, then the more you need to have more technical people involved.
And what we found here through every past guest, what's the consistent theme that we get is people that have a team of OTs. It's not to say one OT is going to be bad, but the people that have the team of OTs seem to be the ones that are getting the more funding, more products, more success through NDIS. So that's just the result. It's not even saying one thing is better than the other. Just seems to be that the people that are surrounding the guests that we've had that have surrounded themselves with teams of OTs that have said, I've worked with this guy for this and that person for that, this person to that, they seem to get everything they want. So it shows me that if you're working with those experts, they know how to get that stuff through because they understand what's important for those, those tips and tricks, just like you're pulling out these tips and tricks on seating. If you know that, you're going to be able to report on that properly. You're going to be able to justify it properly. And so I guess if you've just got one OT, it doesn't mean it's a bad thing, but maybe just be questioning, I guess, your success and what potential you could potentially be leaving on the table.
Absolutely, Ali. And at the very least, making sure that you've got good mentorship, that you've got good supervision if you are working sort of, on the edges of one of those scopes. But like Brad said, we all have, that's a beautiful thing about OT. It's such a broad scope, you can really have a change. But even when I was doing molded seating, even outside of that OT, so I would want the rehab engineer to be looking at anything that before we cut and welded. I wanted the speechy there, if we were doing a molded seat system, to make sure that the user was going to be able to eat and swallow appropriately and not have a choking hazard. For a standing chair, I would have had a discussion with the physio or the GP before we took them into that standing position. It's often about, we just need to know what we don't know as much as what we do know, and reach out within that multi-dis or within our own scope to get more support, because that's going to end up in the best result for that end user. While I've always really been passionate about independence and end user, Permobil also has, like, one of our 4 values that underpin everything is that we put the user first. So we're really trying to work with our end users, seeing what they want, what works for them, what doesn't work for them, and evolving in that way.
That's pretty cool. So we are running towards the end of our time. So what we'll do is one last question, and then we'll get on to our famous question. But I guess if someone is working with the OT and looking at getting their seating set up, is there a standard, like if I've seen my OT 3 or 4 times for trials and errors and fittings and I'm not getting there, when should I be asking questions? How many times do we need to do this? Is there a guideline, or is it just, like we've asked, for example, about driving controls, and Brad has, for example, said that sometimes you just can't put a figure on it, and it's just, you just got to go until you go. And would you say that's the same with seating?
I actually do. When I look at some of the other insurance models around the world, because essentially the NDIS is an insurance model, they often have a set amount of time for an assessment, and you have to do that assessment within that time frame, or apply for further additional hours and justify why you need those hours. And I kind of like that model, because I do feel for some of our end users at the moment that may be going out for a seating assessment, and there's no way to know whether you're seeing Jenny, who's a new grad that graduated last year and has a really good mentor senior working with her. Sally, who's been doing just seating for 15 years, or Mary, who works as a contractor and has no support. Each person's going to take different amounts of time based on their skill, their experience, and the client's situation.
I think the client situation needs to be considered as well, Tracy, because you might be able to expand on this, but somebody with a complete lumbar spinal injury versus a high C spinal injury can be significantly different in regards to seating and posture and prescription of wheelchairs. Am I right in saying that?
Absolutely, and it is going to take different time. And previously we had sort of, like some of the spinal services would do a lot of the spinal seating, so they would become very competent and they knew a lot of the equipment, they knew all the AT out there, so it was easy to match it up. If you haven't had as much experience doing similar sort of bases, you're going to have to do a lot more research on it as well. When I first moved to Australia and I started talking about MAT assessments, and the therapist just looked at me and went, "What?" So I'm really happy to see that MAT has become a big thing and that they've left to the university. But something like a assessment that has a process, that an assessment tool that's going to give you the answers, can save so much more time in the long run. But you need to be competent at delivering that assessment too, to get it in a timely way. So yeah, it will vary the time between different therapists, and it will vary the time between the diagnoses as well, or the impairment that you're following.
I want to ask one more question before we wind it up. And I know we're going slightly over time here, but have you got a couple of top key takeaways when we're talking about seating, specialized seating in a vehicle? So let's say it is actually wheelchair going into the back of a van or something like that. If you got some top takeaways that we should be considering as OTs, general OTs, thinking about transport and mobility, what should they be thinking about? What top 3 things or 1 or 2 things should we all be considering when we're thinking about specialized seating in a car?
I think that, like going back to the pelvis is a foundation. So whatever body position is going to be noted by that pelvis position. So making sure that we have the seating that is going to support the user in the way that we think it will. I have to say the overall seat floor height. So from the top of the head to the bottom of, within that seated position is going to be really important for your vehicle modification service. So that's really important. And what do they want to do? Like, what are they actually, are they actually driving? Are they going to be self-driving? Are they going to be transferring? How are they going to lock down? Can they lock down independently? All these questions that I start to put into that when I'm starting to consider how they're going to transport, where do they want to go, who's going to go with them, is there other family members, are they going to be able to go out as a family if I transport the chair in one way versus another way? I think I've just gone off topic to what you asked me to there, Brad.
Oh no, absolutely. You've got to consider the big picture. You've got to consider the big picture. And I think a lot of OTs consider the home environment, like getting through doorways as an example, and being able to sit in the lounge room and having a circulation space to be able to do that, and having a circulation space on a ramp and so on and so forth for the wheelchair. But I think that it's a little bit of an unknown about what's actually required for the motor vehicle. So I'm glad that you brought it up.
Yeah, that seat to floor height is a big point I like to hide out. I always remember I was we were doing like a trial for someone at Coffs Harbour, and it was pretty gutting, I guess, because they didn't consider. They'd just taken delivery, and it might have been even a Permobil chair, but anyway, they'd just taken delivery of this really great chair, and I was there coincidentally at the time when they'd just taken delivery. Then they went to go into their car, and nothing worked, and nothing fit, and I watched their whole life fall apart in front of them. It was that scene it was pretty traumatizing for me to watch, because like I was watching, I was so excited. I was watching these two people come out going, oh, we've got this new chair and we've been waiting for this. And it was a very expensive chair. I think it was upwards of about 50 grand or something. It was a big setup. And then, no one even thought about that. No one even considered that. It was no one's fault. It was just and they thought, oh no. And I was just, it was pretty horrifying to watch. And so, because they had no other option, because we were there as well, it was lucky because we were there and we got involved, and they said, hey, you guys are the engineers, come over and let's see if we can find out with a solution. And it was pretty depressing because there was no solution, and they couldn't get into a car. The wheelchair was just too big to get into anything, even a hoisted van. And it was, so that's a big takeaway, holistic look at everything.
Absolutely. And because I have also heard families, I assume they've got a van, they've got one child in a wheelchair, that they're going to be okay. But, they need to come and talk to you guys first. Like if they're wanting to take 3 kids out in the back of that van and that to be the primary vehicle, just everything needs to be considered, right? So the other thing that I know that we've done before is drop chairs off to the modification service, just to really make sure that, that's all going to fit in there. Don't, and as an OT, don't make an assumption. Don't say, yes, go buy that car, Mrs. Brown, we could get that modified. Make sure that you have reached out to your local suppliers, your specialists in that area, because we're talking, like you said, Ali, some very expensive, like large chairs, but we're also talking some very expensive modifications, and then the asset of the vehicle itself. So we really need those to all work together to give the best possible outcome for all our users.
That's good. All right, well, look, it's been 20 minutes already. So before we wind up, we ask our guests one final question, and we have had some great answers to this question over the podcast we've done. And just before we ask you, we just wanted to quickly acknowledge and remind everyone of the sponsors that make the show possible: Mobility Engineering and Williams OT. All right, so as we've learned over this podcast, cars are more than just getting from A to B. What is a memory that you have in your car, or something special that you've done that no one knows about, or something unique that you do with your car that you think, or have you done that you think maybe, this is unique to me?
After taking on the job at Permobil, I went and brought myself a Jeep, and it's bright blue, and sent a photo to my manager. When you're so excited about your new job that you colour match your car to the new company, because Permobil has a lot of blues. I guess that's with mine. And I've done driveaways. So around the States, I toured the States, where you just pick up a car and you deliver it to somewhere else, and you don't know where you're going. You've just got so many miles to do it. And we just went wherever there was another car to pick up. And
that's awesome. That's in the US.
Yeah, many years ago now, but yeah.
Ooh,
that's a great opportunity.
That's cool. Yeah. Oh, wow. Okay.
Fantastic.
All right. So thank you very much for that. A huge thank you to our guest, Tracee Lee Maginnity from Permobil. If our listeners have any further questions or want to get in contact with you, we will, if you could send through some of those contact details, we'll put them in the show notes. But is there any other way that you want to share here that they can get in contact?
Always reach out to any of our clinical services team, so the therapists within our team at education.au@permobil.com.
Education.au, and we'll share that in the notes.
Absolutely.
And also make sure you go to the Drivable Facebook page to check it out, and all of the other stuff that we mentioned in this interview, we'll put it there. And thanks again, Tracee Lee from Permobil. All right, stick around, folks. We'll come back, and Brad and I will give our top 3 takeaways from the episode and our expert analysis. Again, thanks, Tracee.
Yeah, good on you, Tracee. Thank you very much for your time today.
Thank you both for having me. See you later. Bye.
All right, cool. That was great. All right, everybody, welcome back. A quick little side note: Brad does have a little bit of an illness, and so I've been doing most of the talking. So just a reminder on that and highlight that. But thanks very much, Brad, for being here anyway. He's a trooper.
I've done my best.
All right. So as we say always in this section, we bring you our expert analysis and top 3 takeaways from the interviews that is for this episode. This is where Brad and I provide more than 30 years of joint experience in the industry, helping people with disabilities to drive and get out in the community in a safe and meaningful way. So we were discussing this just before we started, and the one big first takeaway we took away out of this was, it was interesting when we asked Tracee about what do we need to consider about seating and position and posture and all of these kind of things. And it was kind of a technical leaded question, but then she answered it with basically choice and control. And it's all about, what does the user want? What are they trying to achieve? You know, and it was a great story she said about a picture like what's in behind us, where the person probably should have been traveling in a wheelchair, but that wasn't their goal. Their goal was to actually do something like exactly what you can see in that photo. Go somewhere where the wife is sitting out on the side of the front seat and they're sitting on the back seat and they're just enjoying the view together. And that's all they wanted. And because they'd spent that time listening to them, they were able to specify the seating around that. So those postural and positioning things are important, but it was interesting, very interesting to me that they're secondary.
Yeah, there's so many things that come into it. There's room in your garage, there's room in your driveway, but then also, where do you actually want to get to? And we've done an interview with John before, like I highlighted in the main area, that his main thing was about going to the McDonald's drive-through. But in this case, what Tracee was talking about was getting to the river. And with modifications to the car nowadays, like the pull-out awnings and the turnout seat, you can set up a picnic table and not actually get out of the seat at all, but also get out and enjoy an outing, just like in the picture behind you, Ali. So if you're listening to this on a podcast, make sure you go and check us out on YouTube as well, because sometimes we talk with our hands and demonstrate things and talk about pictures behind us. So make sure you listen to this podcast, but also check us out on YouTube as well, because quite often we're trying to talk about car modifications, and the best thing we can do is see what we're talking about.
Yeah. And that takes us to the next one, which I really loved. For me, what really stuck from what Tracee was saying about her, I guess, little tips for OTs and industry people. One of the big lines that stuck with me was, pelvis is the foundation. Yeah, so that was pretty cool. I thought, like, sort of like what I said to Brad just before we started, the way I visualized that was the pelvis is almost like an OT. It's the person in the middle, and everything connects to the pelvis, you know, just like we've mentioned before, the OT is that hub, that's the central point, and everything comes from the OT. And it's sort of similar to that pelvis. You've always got to take it back to that pelvis. And that was a pretty good point to think about, even if you're not doing the specialized seating. And like Brad said, if you're just a general OT or even if you're a specialized driving OT, well, maybe it's good to be a little bit more aware of the pelvis, you know, and just have that on the mind.
I'm not a seating specialist, and someone will probably listen to this and say, Brad, you're wrong about that certain thing. So please make sure you talk to your seating specialist. But your pelvis has 3 bony prominences: your ITs, your ischial tuberosities, which is the bottom of your pelvis bone, the 2 bits where your hips kind of join in, the 2 bony bits down there, and then your sacrum, your tailbone. If you're sitting on those bits for any length of time, you're going to get in all kinds of trouble in regards to pressure sores. And we've actually had a chat to Tracee off air and talking about pressure sores, and we're actually going to invite her back to talk about pressure care in motor vehicles, but also for those long distance journeys when you're sitting in your wheelchair. So we're actually going to invite her back. She's excited to come back and talk about that. I wish I got more information out of it already, because I'm about to hit the road up to Coober Pedy. So it's a 9-hour drive. I'm going to be having sore ITs at the end of this drive, but we're going to get her back for that one. But getting the pelvis nicely positioned, so you're not sitting on one bone more than another bone, and making sure that you're putting weight onto the thighs, so you spread that weight out and not sit on your sacrum, sitting on your tailbone, getting the back tilt right. There's so much that goes into it that we're going to get it back and really unpack this pelvis scenario so we get it right. And I can't wait to do that.
That's interesting, because the way my engineer decoded what your brain decoded what you said was basically that it sounded like the pelvis is like a tripod, and it's holding you up like it's three legs that are holding you up, and like if you had something sitting on a tripod and it was leaning on one leg more than the other, it'll break eventually, because it needs to have that distribution, that even distribution. So yeah, that's how my mechanical engineering decoded that, that one. So that's cool.
There's so many ergonomics that come into it. We could get an ergonomist, I can never say that word, on the show and talk about the ergonomics of sitting in a car as well, because just sitting on your wallet, we're not that we have wallets much anymore with our phones and so forth, holding all of our cards in it, but the old fashioned wallet that used to be that thick underneath one cheekbone, terrible for your pelvis and terrible for your back.
I personally ruined my back with my wallet and had to repair that over a couple of years. So there you go. I'm a victim of that from about 10.
Terrible. But that's the type of thing that we're talking about for people that have lower lumbar issues, where the pelvis is off angle, and then sitting a long time on one pelvis, on one IT for a long time. It's going to cause a lot of pressure issues. And we've really got to think about that when we're transferring into the standard car seat, especially if they've got a lot of postural supports in their wheelchair, and you're saying, well, it's best to transfer into the car seat for safety. What are we doing to that pelvis? And we've really got to think about that when they're going from a highly supported environment in their wheelchair into one that's maybe not so supported in a standard car seat. And we're going to talk to her and get Tracee Lee back in regards to talking specifically about that pelvis in a car seat. Should be great.
Yeah. Sounds good. All right. And that brings us to that last one, which was
kind of related, which is all about measurements. Yep.
All around the size and all around the measurements. So not just, Tracee and I, we spoke about a story of getting into the car and measuring, that sort of floor to head height and even the width and all of that. But it's not just the bigger measurements, it's also those smaller measurements, as we said, on the hips and the arms and all of those things, and really understanding every single angle and every single measurement that's going there, so we can provide a holistic view. And as you said, going back to be able to understand how can we get that load distributed on the body and supported the right way. And the only way we're really going to know if it's going to work is by measuring it and having that data. And so that was a pretty good point as well, is double checking off that data. And a little catalyst was a little good tip, which Brad added as well. You've got to make sure the person's there as well, but dropping chairs off for trials, so leaving a chair in a house or leaving it somewhere to try in a car. It's a great idea. But as Brad pointed out when we were discussing it, you want the person to be there as well, because again, you might have tried something out. Like we actually had one situation, again, another one that came up to me. We tried a wheelchair lifter with the wheelchair, but not the person on it. And then when they came and they wheeled on, push the button and it wouldn't lift them because the wheelchair lifter and the person together was too much. And again, it was just a silly mistake, So those are little things that we need to do. We just need to double check, triple check, and measure everything, and that's where we get that success.
Yeah. We've highlighted it before. If you're setting yourself up for a trial, which is what we always recommend at the end of every single podcast that we do, and your mobility specialist doesn't ask you to come in and do a trial, I'd be asking and making sure that you're asking why we don't need to come in. Hopefully they've done the modification 100 times before and they just know exactly what they're doing. But yeah, question why you're not doing a trial or having a specific measurement when you're doing quoting and so forth, because you don't want to be living with a mistake.
Yeah, and they can be very expensive, as has been shared in today's episode quite a fair bit. And I guess that's it. So as we wind up, we want to give a huge shout out to our sponsors, Mobility Engineering and Williams OT, for helping us bring you the interview with Tracee Lee Maginnity from Permobil today. Williams OT, driver assessment and rehab is all the pieces of the puzzle to assist people with disabilities reach their driving and community mobility goals. Mobility Engineering is a team of passionate and dedicated people focused on bringing Australia's largest range of suitable transport solutions for all sorts walks of life. And as we say in every episode, the advice provided in this podcast is general in nature. So if you have any queries about what you can do and what will work for you, get in contact with your local OT or mobility dealer and you set yourself up with a trial. The trials really do put you in that driver's seat. So that's what it's all about, getting in there and trialing those products.
And we've highlighted it again today. Absolutely. And thanks everybody for putting up with my slightly blocked nose. Hopefully it's come across all right in the podcast, and we'll see you in the next episode.
See you next time.
Thanks for listening to the Drive Able podcast with Brad Williams and Ali Akbarian. If you like what you've heard, make sure you like, rate and subscribe. It really does make a massive difference. If you or anyone you know would like to share a story about driving with a disability, or you would like to get in contact, find the show notes, or find the resources mentioned in this episode, you can find us on Facebook. Just search @Drive Able Podcast for more information.